Bedsores, also commonly known as pressure ulcers, happen when someone sits or sleeps in the same position for an extended period. Bedsores are classified in stages between Stage 1 and Stage 4, based on severity. Stage 1 is the earliest and least severe and can occur in a matter of hours. Stage 4 is therefore the most severe. Stage 4 bedsores can occur after long hours remaining in the same position, and the patient's skin incurs extensive damage. These bedsores tend to be deep and extensive and can expose vital tissues, ligaments, muscle, or bone, and often become infected. Due to their severity, Stage 4 bedsores require immediate medical attention. In some cases, surgery might be necessary. When left unattended, Stage 4 sores can worsen or even cause death. Stage 4 bedsores are characterized by extreme tissue damage. The most common symptoms for a Stage 4 bedsore include bad odor, pus, redness and soreness around the wound, a dark scar around the wound, blisters, extreme pain, visible tendons or bones. Patients or loved ones of a resident who notice these symptoms should notify a doctor immediately. Certain residents are especially vulnerable to developing Stage 4 bedsores, especially those who had bedsores in the past that were either not treated well or haven't fully healed yet. Other people with these high-risk factors are also highly prone to developing Stage 4 bedsores. Poor hygiene, obesity as excessive weight increases the pressure against the skin, fragile skin, dehydration or poor nutrition, limited mobility, nerve damage. Doctors can diagnose Stage 4 bedsores by carefully examining the condition of the wound and the surrounding skin. However, the doctor might need additional answers before making that diagnosis, like whether or not the patient has had skin ulcers in the past or specifics about the patient's level of pain and level of mobility. Stage 4 bedsores can also affect the body with many different types of physical complications. Several common complications include bacterial infections in the bones and joints, which may limit mobility and cause potentially cellulitis, life-threatening if not treated promptly, and painful calcification, which happens when calcium builds up and hardens on the wound area, which slows the healing process. In some unfortunate cases, Stage 4 bedsores can lead to death. Stage 4 bedsores can cause other complications as well. They can trigger mental complications like stress, particularly when a patient is isolated or lonely or is not receiving the proper care and treatment. Stage 4 bedsores can also drain a person's finances, especially if the wound requires surgery alongside multiple medications and other long-term treatment options. The substantial medical bills of such a necessary treatment plan can lead to large financial complications. There is good news, however. While the effects of Stage 4 bedsores can be devastating, they are both treatable and preventable. Yes, Stage 4 bedsores actually can heal, although how fast and how completely depends on multiple variables. Studies showed that 30% of diagnosed pressure ulcers heal in 6 months, although some may never heal entirely. A doctor can explain possible outcomes and outline the steps a patient can take to increase the chances of a speedy recovery. If a bedsore becomes infected, the chances are high that it'll take longer to heal. An even better solution is to prevent Stage 4 bedsores before they can even develop, through diligent oversight and maintenance. Nursing home staff should take all appropriate measures to make sure that any bedbound resident receives the proper care. Friends and families of seniors in nursing homes can also play a role in preventing or recognizing the signs of bedsores. You have the right to ask questions, voice concerns, and address any problems you're aware of directly with nursing home staff members or other care providers. Your help includes visiting as often as possible, checking a loved one's skin for changes, listening to their complaints and concerns regarding the care they receive, notifying a healthcare practitioner immediately of any skin or health concerns. Nursing homes and their employees have a legal duty to provide adequate care that serves the resident's best interest. Stage 4 bedsores are an extreme injury and can be the byproduct of abuse or neglect by a nursing home caregiver. If nursing home providers fail to provide that level of care, they may be legally negligent for any injuries that occur. If you believe a family member suffers from a Stage 4 bedsore at a nursing home facility, or was injured in a nursing home due to elder abuse, maltreatment, or neglect, contact us for a free case evaluation. A lawyer may be able to help prove that a nursing care facility is responsible for a bedsore reaching stage 4. Our team of legal experts is happy to hear your concerns. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.